I would now like to turn it over to Judge Gary Moore, the president of the National Association of Counties.
Thank you very much. And it is exciting and a pleasure to be with you here today. I am Gary Moore. I am the chief elected official in Boone County, Kentucky. We're called a county judge executive. I'm the past president of the Kentucky Association of Counties and the current president of NACo, the National Association of Counties. My main message here today is to convey the message that this coronavirus pandemic is a public health emergency. It's also an economic crisis. Regardless of our political affiliations, America's counties are in the lead. And we're on the ground. We're the boots on the ground that are working with the health departments, working with local officials, and many others. We're here working to save lives and livelihoods. When it comes to addressing this pandemic, there are no red counties or blue counties politically. So here in my county, I'm an elected Republican. I'm in a very Republican county, and our state, for the most part, is very red. But I'm honored to be here today with other county officials who maybe share another party. Maybe they're Democrat, maybe they're independent. Whatever the case, we are county officials and we're working together. As the pandemic continues, counties, we're feeling devastating impacts, both in our citizens and the lives of our citizens, losing family members, losing friends to this pandemic, but we're also losing our economic strength and in many times our county budgets and other fiscal impacts. I looked at some data before I logged on and compared Boone County, Kentucky to some of the New York counties on the COVID Act Now website. And when you look at our data, there are a lot of similarities in the daily case rates, infection rates, positive test rates, and in some case, the ICU headroom counts. But the crisis is real, no matter where you are, in Kentucky, New York State, or anywhere else across our nation. The relief packages that Congress has passed to date and signed by President Trump, they've been very helpful and they've assisted, but that varies greatly from county to county or state to state. And we can talk more about that as we get deeper into the presentation today. We do hope that an additional relief package happens and that it happens soon and that it has direct aid to counties. And that is something that's very important to us, direct aid to counties. We must put our partnerships together and our differences aside as we move forward. And at the county level, we're trying to lead the way to do that. America's 3.6 million county employees are on the front line, as I said earlier. But think about that, 3.6 million county employees across the country. We have EMTs, we have nurses, doctors, support personnel at our county hospitals, law enforcement officials, emergency management officials, firefighters, public health experts, and human service professionals, and overall our basic county employees that are serving the public. Counties support about 1,000 county hospitals, more than 800 long-term facilities, 750 behavioral health centers, and 1,900 public health departments across our country. With these extraordinary responsibilities, many of which are mandated by state governments and the federal government in some cases, they bear extraordinary costs on the county budgets. NACo found that counties can expect to experience at least a $202 billion fiscal impact through 2021. This includes $114 billion in county revenue losses. So again, my message today is we're in this together. It doesn't matter what party, what state, counties are on the front line. We're working together and we're looking for a strong federal partnership. With that, I'll turn it over to my friend and colleague and fellow executive committee member of the National Association of Counties, the county executive from your state, from Erie County, New York, Mark Poloncarz. Mark?
Thank you, Judge Moore, and thank you for all the great work that you've done leading NACo during this very difficult year. I've had the pleasure to work with President Moore, Judge Moore in the past on the NACo, National League of Cities Opiate Task Force, and the recommendations that came out of that task force, which was a bipartisan task force, were eventually adopted in most states and federally. And that's what we're hoping will happen once again, is that the message goes out with regards to the COVID-19 pandemic, that this is not a political issue. I'm a Democrat, Judge Moore's a Republican. We have Commissioner Larry Johnson, who's a Democrat from Georgia, and County Executive Mark Molinaro, a Republican from New York State. We all agree that this is not an issue related to politics, it's an issue related to the public's health. And unfortunately, we continue to see the too much politicization of what is a global pandemic and a public health care crisis, when we really need to come together, regardless of our political affiliation, as Americans, to say we must address this issue. Of course, New York State has received the brunt initially of the cases and unfortunately the deaths with regard to the COVID-19 pandemic, but it's now everywhere in the United States. Unfortunately, my county alone, we've had 762 people who died from COVID-19, and that's nothing compared with what was seen in the New York City metropolitan area. And unfortunately, compared to other counties across the United States, it's actually much less than some other areas that didn't have many deaths to begin with at the beginning of this crisis. So we come together as not Democrats and Republicans, but as county officials in a bipartisan manner to say, this is not political. The actions that are being taken by local governments are to save people's lives. None of us enjoy these actions. Economies across the United States have unfortunately suffered. It's not just one particular region that's suffering. All regions are suffering. As Judge Moore noted, the billions of dollars in lost revenue that will come for the counties, and of course the costs that we have to incur associated with the pandemic's response, and costs that are not going away. The Federal CARES Act assisted counties just like it assisted states across the United States, but not every county in the United States received Federal CARES Act dollars because of its size. In Erie County, we received it directly from the federal government, but not every county, and most counties, truthfully, in upstate New York did not receive any dollars. Yet here we are, the front lines with regards to the public health crisis, and it's not going away. It's going to be around for the remainder of the fall and the winter. And we know we're going to have extraordinary costs with regards to responding to this crisis. So I joined Judge Moore, and I know my other colleagues, in calling on the federal government to act. We cannot wait until 2021. We have to get assistance from the federal government to help local governments respond, as well as another round of PPP to help our small businesses survive. None of us wanted to be in this situation. All of us wanted to lead our communities and have initiatives that we wanted to put forward to create stronger, greater communities for all. But unfortunately, we were dealt a hand that we just had to deal with. That's the COVID-19 pandemic. And no matter what that hand is, we are going to respond. We're going to respond as Erie County residents, as New York State residents, if you live in New York, and for each and every one of the people on this call as Americans. We are all in this together. We are our brothers and sisters keeper, and we need to work together to save as many lives possible. That's what it's about now. Keeping the spread of COVID-19 down and saving as many lives as possible during what's going to be, in all likelihood, a dark winter until we can have a vaccine that's distributed across the United States. So on behalf of the people in Erie County, I want to thank each and every one of you who's working very hard to address what is truly the crisis of our lives. Hopefully we all survive this, and decades from now, we'll be looking back and talking to people who weren't around and telling them what 2020 was, just like my grandparents did with regards to World War II. That's what we're in. And we need to work as hard as possible to ensure that we're all still around and everyone in our communities are still around. So we have that opportunity decades to now to remind everybody how we came together as Americans and saved lives in a fight that none of us expected, but we had to deal with. And with that, I'd like to turn it over to my colleague on the National Association of Counties Executive Committee, the first Vice President of NACo, soon to be President, my friend from DeKalb County, Georgia, which is in some ways the center of the political universe now, Commissioner Larry Johnson.
Thank you, County Exec Polling Cars. I appreciate the opportunity, and thank you to the media for joining us today. My name is Larry Johnson. I'm DeKalb County Commissioner and also First Vice President of the National Association of Counties. This press conference is not only about us working together, but this is also personal for me. My wife contracted COVID in March when it first started. And we didn't ask the doctors or the nurses, were you Democrats or Republicans? We just wanted my wife to get the help that she needed because she's the bedrock and the center of the Johnson household. So it's very important as we move forward. And now we learned those early on in terms of taking care of her and finding the right type of medicine and nurturing her. And my daughter and I were 100% here, but we also were concerned. And so that's why we're here today. And you've seen Georgia in the news lately, and we're now the spotlight for political reasons. But today my message is not political. I'm here to talk about public health and economic crisis, regardless of our politics we're facing today. You heard a few minutes ago from our president, Judge Moore, who spoke about eloquently about connecting the dots and focusing on our treatment and economics and focusing on counties and hearing, making sure every voice is heard and at the table. And that's what it's all about. He's a Republican, I'm a Democrat. But guess what? When it comes to achieving results for our residents, it doesn't matter. Red or blue, we focus on the human being. And that's what we're here today to talk about. Counties are united, putting politics aside and focusing on effective governing. That's what it's all about, and making a difference in our communities. We at the county level, the level of government closest to the people, are focusing on serving the needs of our residents. And right now, the most pressing need of all counties, not blue, red, or purple, is just the coronavirus pandemic. In Georgia alone, 430,687 people have been tested positive for coronavirus. 8,904 have died. 26,400 residents of DeKalb County have tested positive. We had 446 deaths in DeKalb County. That's one too many. And we have to make sure that we stay abreast of this issue. In DeKalb County, the pandemic has caused jobless rates and unemployment to rise, leading families to scrambling for food to find their next meal. We just completed our food drives this weekend. We had over 2,500 people who needed fresh fruits and vegetables. And we had turned about close to 700 people away. Just at 3 sites. I had 2 myself. But DeKalb County has invested over $10 million for the local DeKalb County organizations through the CARES Act, the $125 million that we received, $600,000 monthly for food distribution to local community food banks. The county has invested $16 million in the DeKalb County Board, our health department, to provide proper testing to our local sites. We've come together to provide a helping hand during the trying times, whether it's a local church hosting a free COVID testing site or giving away a box of essential food. DeKalb County has stepped up to make sure that those in need will get the help that they need. Like my colleagues have said, this crisis is a real emergency. This is a code red 911 situation. It's taking the lives of our residents and disrupting our economy. We're looking to the federal and state partners to help address the community needs. That's what we need. We don't need a political need. We need to address the needs of the residents of our community. We're demonstrating leadership at this county level. This pandemic has, our responses to it are not partisan. As we approach Thanksgiving holiday, let's show gratitude for our many blessings and conduct ourselves safely as possible. We're asking our fellow leaders and our residents to tone down the political charge rhetoric and focus on beating this pandemic. Thank you again for this opportunity. There's an African proverb that says, we make the path by walking it together. The path is not red, it's not blue. It's about defeating this pandemic around prevention and making sure that we eliminate this. So if you don't hear anything today, let's continue to walk forward because we're serious at the county level about solving this corona pandemic, and we can do it. So now I'll turn it over to our county exec, Molinaro. Take it away, sir.
Thank you, Commissioner. I think you're the smartest of all of us, COVID or not. You began by acknowledging and praising the bedrock of your home, your wife. We all are not only envious, but clearly you're the more apt of all of us. It's my pleasure to join my colleagues. Judge Moore, thank you. Matt, NACo, and of course our team here at NYSAC. Thanks for helping to organize. Mark Poloncarz and I have been working with county leaders across the state of New York, and certainly, as we've all said, and one of the troubles of batting fourth is that there's not much more to say, but I will say we recognize and have recognized the important role that counties have played. 1,900 public health departments administered by county governments across America, 1,000 public hospitals administered by county governments across America, and it has been our county employees from fire and rescue to a sheriff's office, 911 dispatchers to public health officials who have been on the front line since very early this year. And for these last months, as we've all said, residents who have been at home scared, hoping that they would be able to return to normalcy, businesses that have been shuttered and some barely open, holding firm to a lifeline. Loved ones who haven't seen family members in nursing homes or in care facilities, individuals with disabilities, all have been reliant on an emergency response structure and county governments, irrespective of party. Those families didn't ask what their party affiliation was of the nurse or the doctor, and they don't ask the party affiliation of their public health employee. And certainly we'd be smaller than them if as leaders we let our party affiliations get in the way of the work that we do. There is no flattening the curve. There is no pandemic response, and there will be no vaccine distribution without county governments. County governments across America have risen to the challenge of our lifetime, most importantly because residents have trust and have faith in us. And as this pandemic has stretched on for so long, we can't allow ideology or fatigue or partisanship to pull us apart. Again, as we start looking at this next phase, Dutchess County, as an example, 2 weeks ago, was monitoring 125 active cases. Today, 609. At this rate, we will be back up at the numbers that we experienced earlier this year. And as we focus on the great advancements that labs, pharmacists, doctors, and scientists across the globe have put forward with the potential for vaccinations, county governments will be on the front line of not only distributing vaccines, but helping to convince residents to be vaccinated. This will likely be the most important role county governments have ever played. And by banding together and working together, we'll continue to address the public health crisis of our lifetime. I want to join my colleagues in saying this. As a Republican judge, we share that in common. I speak to my friends in the United States Senate particularly, but federal leaders of both parties. We need them to summon the political courage and the will to provide the state and local assistance that we so desperately need. It is politically craven to continue to kick this ball further and further down the field without attempting to bring us all together to solve the problem. The county governments have been devastated financially. We have small businesses who rely on us to help distribute federal aid that are barely staying alive and open. And we have mounting costs that are certainly needing to be addressed. We need the federal government to do its job. Never before in the history of America has Congress left its local government partners holding on to a thread or all alone in the face of a crisis. As I've used this example many times, and I'll close with this, this is how we respond to crises in America. When there's a fire, we send the fire department. When that fire is bigger than any one house or any one neighborhood, we bring in mutual aid. And when it grows to something that consumes whole communities, then governments like ours step in to provide assistance. This is how we respond to a public health crisis. And when that crisis grows beyond the capacity of any one county government, we need states and the federal government to step in. I don't expect Congress to send firemen to my neighborhood, but I do expect them to provide us the resources and the support necessary to support the firefighters who are on the streets every day. And in this crisis, they're public health officials, they're emergency responders, they're doctors and they're nurses, many of whom respond to and work with county governments who are coordinating this response. So we're asking our residents to dig just a little bit deeper, to hang on just a little bit longer. And as we look at this great American crisis, that we might pull together in unity as Americans, especially this time of year, to celebrate the good things in our lives. And one of the greatest of all is our capacity as American citizens to set aside our differences and work together to confront the challenge. And that's what we ask for today. So on behalf of the people in this community, I certainly thank my colleagues. I wish all of you a tremendous Thanksgiving and encourage us all to keep it small, but have a very large and thankful heart. And now with that, I want to offer some time to the Executive Director of the National Association of Counties, excuse me, yes, Matt Chase.
Great. Thank you, County Executive, and thank you to all of our elected officials on today, as well as the media. I think as you've heard today, it's great to be represented by these four individuals who are part of the 40,000 county elected officials across the country and our 3.6 million county employees, over 1% of Americans working on the front lines to make our communities better. And as they've so clearly articulated, their job is difficult. How do you protect and save lives while balancing the economic needs of our families, our communities, and our business partners? And what we are seeing today is we really need a resurgence of a national strategy. Federal, state, local, and even tribal partners coming together with a coordinated strategy and open dialogue on how we are going to move forward. And the other part of this that we want to emphasize today is that when we talk about America's counties, we're talking about counties as institutions, those local elected officials and those public servants who are trying to protect and serve our communities, and counties as communities, as geographies. And what we are seeing now as we push Congress and the White House for another round of COVID relief is that the public sector and the private sector are coming together with a unified voice. NACo is really pleased to be a founding partner of the COVID-19 Relief Now Coalition, which is bringing public sector together with the private sector to say, we are in this together, that our economy is interconnected, that we need our tourism industries back, we need our small businesses to open, we need our restaurants to be there in the end. People need to be able to afford their housing and their utilities. And county governments are dealing with the issue of homelessness from every corner of this country. When the public and private sectors come together, it's really a powerful signal to Congress that this is not a partisan issue, that the closure of our restaurants, of our small manufacturers, of our other industries is not a partisan issue, and that it's really our roles and responsibilities as the public sector to come together and to provide that aid. What we have learned from the CARES Act, the big, large congressional package from earlier in the year, is that counties are a great distribution system for the federal government to get money down to every square inch of this country. That some of the large small business aid packages kind of left some of our small businesses behind, particularly those that are 30 employees below, or maybe are women or minority owned and weren't in the traditional banking system. That counties took some of their allocation to make sure that their small businesses could survive. When we look at the jobs reports through COVID, the federal government has only lost 44,000 employees. State governments have lost about a net of 300,000 employees. Well, the local level has seen dramatic losses. Education with the K-12 system was really hit early with nearly 1 million job losses. We're still short close to 600,000 local education jobs. In the non-education numbers at the local level, we are still down close to 400,000 jobs. And that is because the CARES Act helped us preserve and keep some of our frontline employees, particularly our public health folks, employed. But as the CARES Act money runs out at the end of December, we will see those numbers really spike as we move into the new year. So again, like the four county executives and commissioners, we also call on Congress to work in a bipartisan way to really bring another round of relief for the public sector and the private sector. We know that the COVID pandemic is going to continue at least for another 6 months, and we really need to come together as a country. So with that, I thank you again, and we'll turn it over for Q&A.
We'd like to open it up now for Q&A. The first question, you can ask a question by typing it into the chat area of your participant panel, or you can raise your virtual hand or take yourself off of mute. We have one question in from Spencer Chase. A pushback on the push for state and local funding has been that there is money that has yet to be used. On the local level, is that true? What was the funding used for? What is additional funding needed to do?
Well, from Erie County's point of view, I can tell you we did receive CARES Act funding, and we're going to spend every penny. We've invested it not only in our public health response, we have invested it in a number of programs to assist small businesses, including a $20 million fund, which was available for grants for small businesses. We've created virtual learning centers so that if parents have to put their child in a virtual setting for learning, but they still have to work, they can do it in a safe environment. We provided more than $15 million of direct assistance to school districts to help them with virtual learning costs, as well as protecting in-person learning by purchasing the right equipment to ensure that their schools are safe. Erie County did receive over $150 million in CARES Act funding, and when all is said and done, we're spending it all this year. We're not going to leave money on the table. So if there is money being left on the table, I do not believe it's at the county level. I can assure you that counties are spending the money and they need more, especially considering the CARES Act funding had to be spent by the end of December. So there's no federal aid for local governments starting in January. The coronavirus is not going away. It will be here in January and beyond.
This is Gary Moore, and I don't know if your question would be New York specific, but here in Kentucky, our governor suballocated a portion of the state CARES Act money to those counties that were under 500,000, and Boone County received its portion. We have applied and allocated all that was suballocated to us. Right now, we're in what we're calling a leveling process where any city or county that did not spend their allocated money from the state is going back into a new pool, and that'll be allocated back out to those of us that did spend all of our in the next 2 weeks, and we have till December 30 to spend it. So we're spending every cent that was suballocated to counties under 500,000.
If I could just add briefly from a national perspective, and Matt Chase with the National Association of Counties, is we would prefer to use the word invest, and that our counties are investing in our local communities. And we're investing for the immediate pandemic. We need to really ramp up our testing. We cannot get our economy back up on its feet long term without sufficient rapid testing. We continue to need PPE, especially as this pandemic drags on. We need to prepare our small businesses and other business partners to be nimble and to really be prepared to survive long term. And that includes moving a lot of their technology to the cloud or being cyber secure, learning how to work digitally. We have long-term investments as a nation in broadband that we shouldn't just try and mitigate the current pandemic, but as a nation, we should really build our long-term resilience so that when we have the next pandemic or the next national shock, we're not caught off guard as a nation. So we really see this as an opportunity to take the worst scenario possible and turn it into a positive. And let's build a more resilient nation. Let's have our schools be prepared. Let's have our businesses be prepared. And of course, as county governments, we're really trying to make sure that our services to our residents remain uninterrupted, whether it's a snowstorm or a global health pandemic, whatever it is, we can continue to serve our communities.
Let me just offer from a smaller county perspective here in New York, and Mark, of course, the county executive of a county that received direct CARES aid. Keep in mind that for counties under 500,000, again, many of which are certainly north of the Hudson Valley in New York State, many didn't receive any direct aid. So the dollars that we were able to secure through the CARES Act are specific to needs. They might offset some transportation costs, or as Mark alluded to, in our cases, smaller counties would have received some funding through the block grant program with very specific federal expectations. In my county, we directed most, if not actually all of that aid to tenant protection, to small business grants, to daycare scholarships. But we don't have the ability at this county level, again, and of course, counties of every size have been facing the same mounting problem. The direct loss of revenue, not having the ability to receive federal assistance without those specific parameters, is really what we're focused on now. We have county governments, most of which, and certainly here in New York, overwhelmingly rely on sales tax revenue. That of course came to a screeching halt during much of the economic shutdown, and as all of us have acknowledged, so that general revenue supports so many services, from mental health, substance use disorder, to road patrols for the sheriff's office. But as all of us referenced, as the pandemic moves on, and no matter what it is the federal government or state governments expect to put resources toward, county governments are going to be the ones making the connection for residents. It's going to be our small businesses that reach out to our economic development teams, our tourism departments, our public employees to make that direct connection. When they run into trouble accessing unemployment, they call us to make those connections. And it's our staff who are responsible for assisting that direct connect between constituents and residents. That's why the broader federal aid is needed. And I would offer that counties across New York have asked for sub-allocation here in New York State. But the reality is, as we know, if New York State continues to have such a gaping hole in its ability to operate, there's only so many places that the state government can turn. So the challenge is, of course, not to balance the state's burden onto county governments, and we at the same time need those resources to provide the services that residents expect.
Thank you, County Executive. I would remind reporters on the line that they can ask a question by raising their virtual hand, and we will unmute your line, or you can type a question into the chat area of the participant panel. Our next question comes from Todd Neely. What are your general concerns about the health effects of lockdowns in various communities, i.e. other problems including drug use and other health issues? Are other societal challenges resulting from the pandemic taxing your budgets?
From the Erie County perspective, I wouldn't say they're taxing our budgets, but we still have these issues that have existed for quite some time. Interestingly, when we're talking about increased drug use and overdoses, we're not seeing the overdoses in the traditional area where we saw for a number of years, and that Judge Moore and County Executive Molinaro and I worked on with regards to the opiate epidemic. We're actually seeing increases in overdoses associated with habitual cocaine users, now that it appears the drug dealers are spiking cocaine with fentanyl to make it stronger and more addictive. So we have seen more overdoses in that regard. Interestingly, we look at the suicide numbers, and our suicides are actually down for 2020 based on what would be considered 3-year rolling average. So there definitely is an attempt by the community to offer support to those who are in need. And while it's been very difficult because of the COVID-19 pandemic restrictions that have been put in place for quite some time, even with the easing of them in the summer, the not-for-profits that exist, as well as county government on our end, have worked very hard to address those issues of concern. We're just one example of it. My county's urban, suburban, and rural. And when it comes to drug usage, that never goes away regardless of what time it is and what you're dealing with. It just may change, and that's what we saw this year, is a little change. And thankfully, at least on the suicide end, we've actually seen a reduction based on the 3-year rolling average, though that's not to denigrate any family that lost the life of an individual who died of suicide, because we know how destructive that can be to any family. So it's we're always dealing with challenges. That's the one thing I tell folks, is that even during the COVID-19 pandemic, we're still dealing with snowstorms in the winter in emergency services, and our public works, having to repair roads and bridges. Counties don't get a break from providing the other services that we do offer our citizens just because we have to address the COVID-19 pandemic. We still have to do that and be the leaders on the front lines when it comes to responding to the needs of our community in addressing the coronavirus. That's why, once again, I'll affirm what we've all said. We need help from the federal government with another round of assistance so that we can help pay for the services that we have to provide, regardless of whether we have the dollars to do so.
This is Gary Moore. I might add, one of the impacts we're seeing to stay-at-home orders is the need for broadband. We have way too many unserved and underserved residents in our county here in Boone County, and I'm hearing the same thing from counties across our nation. We are investing millions of dollars in a broadband program here. We've received our RFQs back from providers, and we'll be going through interviews in the next couple of weeks. So at the NACo national level, we created the broadband task force. And we know that with stay-at-home orders, that you have a parent or two possibly working from home, that you have telemedicine, e-health visits, of course, non-traditional instruction with NTI learning of students at home, and senior citizens that are shut in, that are needing to communicate and contact with other human beings. So broadband has skyrocketed to a piece of our infrastructure that is at the highest that you could imagine. So we're focusing on that for our investments from CARES Act money and or other revenues. That's one of the impacts of the stay-at-home order.
Okay, without any further questions, I would like to go around to the panelists and offer a 1-minute close for each of the panelists, beginning with County Executive Mark Poloncarz.
Thank you, Mark. I don't really have much more to say other than we're all in this together. I said we need everyone to be their brothers and sisters keeper. This is not about politics. This is about protecting the public's health. And for those that are politicizing this, including those in the political arena, because I know there are some that are doing it, you're actually hurting our efforts to respond to the COVID-19 crisis. We need everyone together joining our proverbial virtual hands, because we don't want to touch each other in this situation, to work through this. And if we do that, we will all get through this as quickly as possible. And in the end, that's what it's about. It's about coming together to serve our public that we represent, but more importantly, as Americans, to get through what is the crisis of our lives.
NACo Executive Director Matt Chase.
Thank you again. And just two quick comments. One is, this is a dual challenge. It's a global public health pandemic. It's global and it's national, which means we need a strong national leadership from the federal government down to the local level. That as we move into the winter, we are now approaching our worst levels of both deaths and illness. And two, it's an economic pandemic. That in March and April, we reached over 30 million unemployed Americans. We've made progress in rebuilding the economy. But today, we still stand at 10 million unemployed Americans, including many who are becoming permanently unemployed. To put that into context, we're still 1 million jobs short of the worst part of the 2008-2010 Great Recession. So we are currently, as we stand today, in a worse position financially from an economic standpoint than we were during the Great Recession. That just shows you how deep this pandemic has been and how much work we still have ahead to rebuild our economy.
President of the New York State County Executives Association and Dutchess County Executive Marcus Molinaro.
I thought I'd keep it personal for my last moment. There are countless families across this country who have been broken apart, whether it be a family member who's still struggling for life in a hospital or in isolation and alone in a nursing home. There are families that will come together virtually or physically this Thursday that will have empty chairs. For those who know me in New York and my friends, they know that my father and I, as I grew up, we grew apart. As I got a little bit older and have had the pleasure of serving with so many good people in public service, we became close again until my sisters called me the first week of April and informed me that my 67-year-old healthy father, proud Democrat and Communication Workers of America steward, was taken to a local hospital because he had lost a significant level of oxygen and was having difficulty breathing. Within 3 hours, I had a brief 5 or 10-minute conversation with my father, who was then ushered to an isolated room, and then some days later onto a ventilator, and then as most know, 2 weeks later succumbed to the disease. I had prayed really hard that perhaps my dad and I would have 5 minutes more. And on April the 10th, at 1:59 p.m., I just happened to call the nurse and said I'd like to speak to my father. And I spoke to him and told him how much I loved him and that I would continue to do the things that I think made him proud. And at 2:04 p.m., he passed. Now is not the time to allow partisanship or ideology to get in the way. We can have a lot of disagreements about a lot of things. Those of us at our level, those of us here in local governments, we're all trying to do our job well. And we just need our residents to dig a little bit deeper to show some consideration for families that they may never know but are struggling. They should be grateful and thankful if they're healthy and never contract this disease. But to show some degree of solidarity and kindness and consideration to those who are struggling today, either with loss or to overcome this virus. And I'll leave it at that. If we show consideration to one another, if we take the precautionary steps we've talked about and be smart, we can weather the storm as individuals and as a community. So I thank my colleagues for the time this morning.
NACo President Judge Gary Moore.
That's hard to follow. Executive Molinaro, we know that our families across all of our communities are experiencing what we just heard. And while we may focus sometimes as elected officials in counties on numbers or data, sometimes politics, we can never forget that it's about the lives and the well-being of our citizens and our loved ones, our families. And I think I would close with that. We're working hard. We take this responsibility seriously. The people elect us to lead and to do the best we can to guide our communities. And but we can never lose that personal touch, personal effect of all of that. So thank you.
Thank you. And on behalf of the New York State Association of Counties, we thank all of our panelists and all of our reporters for joining us here this morning. This webinar, or this press conference has been recorded and will be made available to all participating reporters this afternoon. On behalf of NYSAC and the National Association of Counties, if I may, Matt, we wish you a joyous and thankful Thanksgiving this week. Take care.